Hello, I am Dr.Jaymohan Unnithan from Institute of Lung Care and Research, Coimbatore, placed at Hindustan Hospitals. The hot topic of today is COVID vaccination. There has been people who are hesitating to take vaccine, and now there is a clamor for vaccine. Now, many of my patients who suffer from many of the diseases, respiratory diseases, there is a lot of doubt in their minds whether they can take vaccine. So frequently asked questions that I hear in my OPD are, Doctor, I have asthma and COPD. Should I take vaccine? The answer is definitely yes, you have to take vaccine. A little bit of allergy or some respiratory diseases are no contraindication for taking a vaccine. Vaccine has to be taken. Without vaccine, we are not going to conquer COVID at all. Second usual asked question is, what are the diseases in which vaccination should not be taken? There are some diseases in which when the patient is on high doses of steroids or immunosuppressants, they have to be tapered and brought down to the optimal levels, minimal levels, and then vaccine has to be taken. If there is a condition in which these cannot be stopped at all, the vaccines can be taken. Only thing, the immunogenicity will be less. So vaccines can be taken in consultation with your doctor. Another question usually asked is, what vaccine I should take, doctor? Any vaccine that is available, take that vaccine. All the vaccines are effective. Don't go on the paper reports that this is 95% effective, that is 78% effective. It will be effective. You have to take vaccine, whether it is Covishield or Covaxin, or it is the Russian Sputnik vaccine, or is it the Pfizer vaccine. Take vaccine, protect yourself, and take 2 doses of vaccine at the stipulated times. Now, another question that is usually asked is, I have to take my influenza vaccine. Can I take the COVID vaccine along with that? Definitely the answer is no. COVID vaccine and any other vaccine should have a gap of 2 weeks, at least 2 weeks or 15 days. You have to give a gap of 2 weeks when you take the vaccine. Another frequently asked question is, what disease conditions one should not take vaccine? That is COVID vaccine. The diseases in which are when you are acutely ill, that means you are suffering from an acute disease, like you have got which can cause immunosuppression, like you are febrile, you are having a viral fever, you are having some other serious systemic disease. In those cases, one should wait for the disease process to be over before you take the vaccine. Then what are the drugs I should avoid when I am taking a vaccine? As I said earlier, steroids, systemic steroids, not inhaled steroids, systemic corticosteroids and immunosuppressant drugs, if possible, have to be avoided because that will interfere with the immune response system. Can vaccines be taken in pregnancy? Another question usually asked. Yes, it has been proven that in pregnancy vaccine can be taken, and now vaccination for pregnant ladies have started. Thank you very much.